morning and welcome to Resolutions for Recovery. This show is dedicated to the education and empowerment for all people, families struggling with substance use disorder. Today we have a really special guest, my friend Stephanie Campbell from New York State Office of Alcoholism and Substance Abuse, OASIS. And there is a brand new program called CHAMP, the Ombudsman Program. And you know, back when I struggled through with my son, we were told on more than one occasion, he's not high enough for treatment. That one really still always gets me. And we never seemed to ever be able to access insurance because he always had to jump to this next level. It was never treat him where he was. He always had to get sicker. And this was the only disease that I ever found that people had to get sicker.
Right.
And speaking, you know, when we started advocating, speaking to, you know, on Long Island, it was always the 1 in 9 for breast cancer. Mm-hmm. So speaking to certainly Senator Hannan at the time and Senator Boyle, if an insurance company said to a woman, we know you have breast cancer, we're going to put you in group therapy and let you talk through this for the next year, we know that you have a fatal progressive disease and we're okay with that choice of treatment. He said, well, that would be unacceptable. I go, but why isn't it unacceptable for substance use then? Because it's the same thing. We let a fatal progressive disease become just that.
That's right.
You know, and my son and too many people have succumbed to the disease. And really that's what I fought for was, you know, the access to treatment. You can say that you have coverage, but you were never able to touch it. It was imaginary. So I'm so happy that we have this because people need to know what their choices are. And first and foremost, in New York State, have insurance, don't have insurance, you can get treatment at the New York State addiction treatment centers.
That's right.
So, how are you, Stephanie? Thank you for driving down on a rainy day.
Well, you're in my heart, as you know, and you continue to inspire me on a daily basis. So, so thank you for the invitation. I'm honored and privileged to be here. And, you know, to your point, Linda, there is such still, even with all of the advocacy that's been done, there are still where stigma shows up,
yes,
you know, around this illness, still is in the areas of, you know, in some areas of healthcare and in particular also in how the insurance issues are addressed, that we're still treating addiction in some cases as in the acute phase and not as a chronic illness that needs ongoing
support.
Absolutely. Absolutely. And there's been some, because of people like you, who have been on the front lines advocating for years, New York State has made some real advances in terms of the legislation and regulatory changes that have happened. Most notably, I know that you were involved in 2014 in the advocacy around changes to the insurance law that happened in terms of prior authorization, because we used to have to fail first, right?
Yes. Oh, I was told to, you know, and actually still remember that meeting when Thomas's ashes got slid down the table and said, there's fail first.
Yeah, yeah.
Questions?
That's right.
And no one said a word.
That's right. I've heard of that meeting. I wasn't at that meeting, but I've heard of that meeting.
Got a little contentious.
I heard. But so powerful in that, you know, you and our stories, and, you know, you and I have talked about this when I was in my other role at Friends of Recovery New York, but our stories have power. You know? And, you know, on the family side, the fact that, families are still desperately trying, to get their loved ones into treatment. And so because of the advocacy efforts of you and Avi and, Terry and so many
We'll be back.
people across the, and Anthony and all of these folks. And then even, on the, in the recovery community
Yes.
side, in terms of Friends of Recovery and FIST and all these organizations, the Long Island Recovery Community,
Yeah.
right? They've done a tremendous amount of advocacy work as well. That, Rob Kent and the folks at Oasis took, the recommendations and the stories, the real life stories that were brought to the legislature and brought into these meetings. And through the advocacy, there was the creation of, the laws in 2014, and then 2016. And then, most notably, this past legislative session in 2018, through the efforts of Legal Action Center,
Yes.
The New York State Council for Community Behavioral Health Care for New York, yourself and other community organizations, we were able to get $1.5 million to fund the new Behavioral Health Ombudsman
Yes.
program. And so, that really is, the first of its kind that I know of in terms of specifically here in New York State that is dealing specifically with addiction and mental health.
Yes.
So not just on the substance use side, because we know, and you and I were talking about this before, we started our conversation, that there's oftentimes so many co-occurring issues that have not been addressed. And so we also we know we're in the midst of this incredibly devastating opioid epidemic, but there's also a suicide epidemic where people who are suiciding.
We can't take alcohol off the table.
That's right.
Through the holidays, the amount of people that were in the emergency rooms for alcohol. People are struggling and suffering with such great sadness through. You don't know what anybody's walking because you don't know what anybody else is walking, and there's no kindness and compassion in the world. And people go home, and the holidays are a great example of when profound grief can really take over. Sadness, depression. And we have to come out of the woodwork with all of this. And there needs to be more, people can't afford, right? Certainly, but even with insurance, the co-pays, and nobody's willing to work with these folks. We have to be able to work with these.
There are conversations that are happening now to address. I know there's a lot of advocacy around addressing the issue of co-pays because, as we know, you can have insurance,
right,
and yet not be able to access that insurance because you can't pay. I just had a call this week. An advocacy organization up in the Buffalo area. Who will remain nameless for the moment, contacted me and said, we have a young man who is on his mother's insurance, and but the copay for him there's such a high deductible, there's a $3,000 deductible for him to access his insurance. So before he can even access the insurance, he has to pay $3,000. He has no job. Right. He needs treatment 3 times a week in an outpatient clinic. So that's $600 at $200 a pop per session for 3 days a week. And he can't, he can't afford it. So we were able to get him to the, through to the CHAMP helpline. Part of what also happens on the CHAMP helpline is, if you have insurance and yet, you can't access that insurance, we can help you get, we can help you get onto Medicaid, which, as we know, is we've made a lot of incredible insurance legislation and reform around Medicaid, and we're working on the commercial side to make it more accessible and still,
every time a change is made, they find the loophole. So you're always constantly going back. So it's not that insurance companies should not be allowed to make a profit. That's not my
They're a
point at all.
business. They
They're a
need to
business,
operate.
and we need to remember that they're a
That's right.
business.
Yeah.
But just because they say no doesn't mean that no is the final answer, right? But they also shouldn't be able to post record profits because there's debt that's associated with record profits and a bonus that goes to the CEO who, for saving them so much money. That's human life on the other side of that. So it's a business that has a very human side.
Right. Well, and I think, too, that part of what we're trying to do is engage in bringing the insurance sector to the table and say, it's beneficial for you.
Yes.
It's cost,
Effective.
effective for you if you treat this illness appropriately, right? And so, because of the archaic way that this illness has historically been treated, we're now really beginning, because of evidence-based, practice and good practice, in understanding that if we treat it like we would treat diabetes, or we would treat hypertension, or we would treat heart disease, or these other chronic illnesses, that if we provide effective treatment, that our costs will go down and our constituency will be healthier, right?
Yes.
So how do we bring folks in, to the conversation in such a way where we can have that dialogue? And I think that that's beginning to
Well, for the
happen.
insurance companies, and unfortunately I've spoken to people at insurance companies before, death is often, you're either not going to be our insured, as we continue to say no, you won't be insured with our company anymore, or you'll be dead, and we still won't be paying the claim. And they're willing to ride that line, and that line is unacceptable because we can't afford. We shouldn't even consider that as an option. Correct? What they fail to realize is the most expensive treatment for them is certainly an overdose in the ER, and the first 14 days of treatment at any place. And yet after 3, 7, 14 days, they are discharged from treatment.
Well, that's against...
Right,
that's against some of
it
the...
still happens. And
when that does happen, what we're doing is we're encouraging folks to appeal, because here's the thing. Government doesn't know what they don't know.
Correct.
Right? And quite frankly, the insurance companies may or may not know, but they don't know what they don't know. So we need to be able to collect data, similar to on the medical and surgical side. When we started to determine what best practice was to treat certain illnesses, certain diseases, certain issues of the body, of the physical health, that we had to be able to document and collect data and evidence, and then be able to present that evidence, in the appropriate fashion. I think on the mental health and substance use side, we have to similarly do the same thing. And in terms of claims, on the insurance side, and here's the thing that we're hoping that the CHAMP helpline is going to be really effective. When a family member has a loved one who needs help and is being denied access to their insurance benefits, they're in crisis. It's not just the person who, with the substance use or mental health issue, that's in crisis. The family's in crisis. So we need a place where we can help guide folks through that process, help them know what their insurance rights are, help them, fight the insurance denials that come up for mental health and addiction care. Allow them the space in which to work with someone that can help them appeal, the denials that happen. Give folks the space in which they're educated so that they know how to navigate around barriers to their insurance and other issues of discrimination, and really how to get the most out of their insurance coverage. Because when you're in crisis, the last thing that you're going to be able to think about is, how do I navigate through this whole process?
And just from experience, you can't.
Right.
There's other family members. So as the mom, there's other children, there's a job, there's bills to pay, and you have a loved one in crisis that could, at any moment, you get that phone call that you don't want to get. It's life and death.
Yeah.
And then you have to figure out how to, you can't, you just need somebody to hold your hand and say, okay, let's make this call together. Here's the steps, and we're going to bring you through that. Because left to your own, that's the last thing that you're going to think about. Because what's the only thing that's on your mind? I got to keep my loved one alive.
That's right. That's right.
I have to keep all the other balls in the air, that everybody is safe and sound, fed, clothed, housed.
The job.
Exactly. And the last thing you're going to worry about is fighting with an insurance company, because you just don't have it in you.
Yeah. Yeah.
You just don't.
Well, and to your point, there is a certain amount of, awareness on that end that may be the case. And so, what we're hoping to do with the helpline is to really provide that support and help folks navigate. The other thing too is that the partners on this project are really experts in their areas, and so we have the Legal Action Center, who's been working on the issue of parity for years. And have done such a tremendous job in.
And why can't we get that though? Why
parity?
Yes.
Well,
so just say what parity is, because there's maybe some people.
The very definition of parity makes it difficult, right?
Yeah.
So when people say, well, what is parity? Does that mean that, I get to have whatever, benefits or access to whatever treatment I want? Well, parity is really that the insurance, benefit is on par on the behavioral health side as it is on the medical and
so
and
whatever I would
surgical.
be entitled to for heart disease, I am entitled to. They can't cut my benefit simply because I may have behavioral health or substance use disorder.
Yeah. But it's complicated.
It is complicated.
And so having partners like the Legal Action Center who are available to help folks navigate and help us, collect the data and work on appeals is critically important. We're also partnering, the organization that was contracted out for this is the Community Service Society, CSS, and so it's really based on a hub and spoke model, whereas the helpline is operated out of CSS's. They also have the CHA helpline, which was set up to help folks get onto the exchange and help them access health care benefits. So they're now helping us with the CHAMP helpline. And for those who don't know what CHAMP stands for, it's the Community Health Access to Addiction and Mental Health Care Project, so CHAMP. And it really is a program to help folks get the most from their insurance benefits. But so CSS is operating the helpline, which for our viewers is 888-614-5400. That's the helpline. It is open, operational Friday, 9 to 4. And but then we have these partners such as Legal Action Center, such as the New York State Council for Community Behavioral Health Care, such as the Legal Aid Society, and such as the Medicare Rights Center. These are the specialists that are also taking cases. They've got attorneys on hand that can help folks navigate, so that if they're denied, they can help appeal.
There's our we're going to have the brochure and all the information up on the website, so we'll make sure we get that out to everyone.
Wonderful.
Because, unfortunately, it goes on and on and on and on, and when substance use and with underlying really mental health issues continues.
Well, this is a joint project between OASIS and the Office of Mental Health, which
is amazing in and of itself, because that we've kept those two
very separate.
Very separate.
And I think it points to the leadership of those two organizations and the effectiveness of their working together that has created the opportunity for this to be. I think it's critical. And you and I, again, we were speaking about this, that the co-occurring piece. We treat the addiction, but then if we don't treat the mental health aspect of it, then unfortunately a lot of people with years of not using substances at some point can succumb to their mental health
So we just said Philip
issues.
Seymour Hoffman after 23 years.
Yeah.
That wasn't a choice that he made.
That's right.
That was just the disease
That's right.
that
That's right.
called,
Yeah.
that demanded, that all of those things underlying. You know, unfortunately, we were just talking because, you know, Thomas's Hope is providing some grief recovery workshops, and everyone has grief. And people, when people think of grief, they only think of loss of life. But there's so many more things that we grieve about.
Relationships,
Relationship,
jobs,
right, jobs, moving.
age, even when we
Age,
move from
empty
one.
nest.
I know.
Right? You know,
Yeah.
all different things that you know, when we talk about substance use, parents have grief over what they thought their children's life would be, what they thought their children's life would be, not necessarily ever agreeing with the child, so let's, you know, we'll put that out there. But that's grief. And somehow that resonates, you know, and you need to put all the pieces in its place. You know,
Well, we know it's a family illness, right?
It is a
affects the
family
entire family, and there has to be healing and recovery that's done on the
On
family.
both sides.
And that grief is a part of that. You know,
Grief is.
that how we deal with grief and trauma. You know, we know that
grief,
trauma is
guilt
yes.
of what you think you did or didn't do.
Oh, and as parents, that's such a huge
And
piece.
that's huge. And, you know, I always tell parents, you're doing the best job you can at the moment in time that you are.
That's right.
When you know better, you will do better.
That's right.
But you can't make better choices if you don't have more information and knowledge. Knowledge is always power.
Yeah.
And you need help to mitigate through all of this. You know, so there's so, you know, for everyone dealing with substance use, there's underlying trauma somewhere along the lines. You know, children that are 12 years old don't pick up we've done a really good job educating young people, children, on the dangers of alcohol and drugs. They know that drugs and alcohol are bad for you, but they need an escape. So we need to find out, why do you need that escape as a coping skill? And not give them the coping skills that can help them stay away from doing, you know, and then of course there's always going to be that one high risk decision, not a choice. All kids make high risk decisions, and there are going to be too many kids that are turned on, their brains are turned on to substance use. That switch gets flipped on. They didn't choose to be that.
Yeah, I think we are, to your point, doing a really good job at the educational piece. But, you know, it goes back to something that you just said, which is that when you're, you know, that what is it that's the driving force behind someone, you know, using to the point where, you know, they cross that threshold and go into active addiction. And you know, I think an advocate that we both love and respect talks about the book Dreamland,
Yes.
right? And Sam Kionis is
Phenomenal book.
phenomenal book.
Yes.
And you know, and Rob often says in the conversations that he'll have with folks that, you know, that Sam's quote about, you know, addiction, you know, the cure to addiction is not Narcan. And I like to put it, it's not just Narcan, because certainly
Yeah.
we want to get Narcan out to
on
the
the streets,
communities,
right.
and, you know,
Absolutely.
if we're dead, we don't recover, right?
Correct.
But it's community and it's connection, you know, and that was, in my case, what saved my life was, you know, someone reaching into the abyss and saying, there's hope.
I got
you know,
you.
and people do recover, you know,
got
and
you.
continue.
Yes.
To continue, because it's a lifelong journey, you know, that, you know, we need those people with our illness need those supports and services. You know, just like, again, if we had any other chronic illness, you don't say to the person with diabetes, well, you know, you got over your diabetic shock.
You're
you know,
good.
Stay away from those donuts. Have a good life, right? Like, we have ongoing
Support
you know,
and treatment.
support and treatment. Exactly.
You know, I have a family member that, you know, just recently, a few years ago, was diagnosed with type 1 diabetes, which is really, you know, but the wraparound services that came with that diagnosis
Yeah.
just truly, and I'm not saying that it shouldn't happen. It should happen, but those wraparound services need to happen for all diseases. Because if substance use had the same level of wraparound services, failure would be so minute. I truly believe.
Well, and when we're provided that, when we're given the recovery support services, the treatment and the recovery support services that we need, we go on to live extraordinary lives.
Absolutely.
We do recover. And I think that, part of, I know you've seen Reversing the Stigma, but one of the beautiful things about, those kinds of public conversations is that people are able to see that, people who are addicted are not doomed. It's not a death sentence.
Right.
We actually do recover. And, and that if that investment is made, the savings, the cost benefit of treating folks is incredibly beneficial.
And
not just to the just to the person, but to the entire family and community,
family
right?
and community. Because listen, we have Donna Mae, right, in Staten Island, who is just going to be turning 70 this year. Certainly.
Is she really? She looks terrific.
If 12 Tins was the name of her book, and I read that book, and the sexual abuse and she's open about this, what she lived through, and if anyone needed an escape, is someone living a childhood that she lived, right? And going through all of that, but then coming out the other side and finding recovery, not after one time at recovery, right? Many times at recovery. CASAC, running all different kinds of programs, advocating for every group out there, and doing the work and treating people like humans.
That's right.
I love what they do on Staten Island, but even in Harlem, they feed them. Everybody sits down and eats together, that community again. We're a family and you can depend on us. It's not, we're an island. Okay, now go to your meetings. Now go do this. Now go on. It's not going to happen like that.
Well, and it back to what Sam says and what we've been talking about, that the antidote to addiction being community and connection. Addiction is a disease of isolation and shame, and
it likes to drag you back there.
It certainly does, and so if we can, have that connection and get folks, connected and plugged into, that recovery community and that ongoing support.
But, it's the same thing, and I'm sure when I was little, I'm the youngest of 5. If I was riding my bike where I wasn't supposed to be, by the time I got home, everyone on my block and my mother was waiting on the stoop. What were you doing over there? Because everyone watched out.
Yeah.
They didn't wait for something to happen. They didn't talk to everyone else and say, oh, Linda's going down the wrong path. No, they reached out to my family, right?
Yeah.
So we're going to be right back after this message.
One, two, three. Long before my dream of playing professional football became real, addiction impacted my family and nearly destroyed it. As a New Yorker, I can tell you that all our communities are being hurt by addiction. New York State is leading the fight in combating addiction, providing help and treatment regardless of your ability to pay. For more information, visit combataddiction.ny.gov. Growing up as a young kid when addiction was around was tough. You know, it was, you know, at the time, you know, I felt like it was unfair. I had to grow up quick. You know, at the age of 11, my father left the house after, you know, a couple months after I found drug paraphernalia in their nightstand. You know, and it was a tough reality to face as a young kid. And, you know, there were good days and bad days, but there were a lot of bad ones. You know, after my father left, you know, we got kicked out of homes. You know, there were people in and out of my house, and I didn't understand, you know, why did this happen to me? You know, why did addiction have to be, why did my parents have to be addicted to drugs? Yeah, going through recovery it was a long road. You know, when I was a senior in high school, my mother went away to prison. You know, I had to go through my college recruiting by myself. I had to go off to college. You know, my friends' parents took me to college. And so it was tough going through those times. But when my mom decided that she wanted to change her life, she wanted to get help. You know, my mom got sober in prison. She got out of prison and gave up drugs and regained her relationship with God. My mother works for the church now, and we have a great relationship. I tell her every time I talk to her how proud I am of her and what she's accomplished. You know, she's a tough woman. She's been through a lot, but the things that she's done after prison have been amazing. You know, I'm so proud of her. She got her associate's degree. We have a great relationship. She's a great grandmother to my nieces and nephews, to my children. She's always there for me when I need to talk to her, and we have a great relationship. For a while, it looked like, you know, when you're in it, when you were in the addiction part of it, I never thought my mom would be the same. But there is a light at the end of the tunnel. You can change your life, you can get help, and you can have a better life and regain those relationships and have a positive effect on those people around you. You know, I look at, you know, when I go through tough times in my life, I ask myself, what would my mom do? Because my mom has been through, you know, I always say my mom has been to hell and back, and she's doing great, and I'm thankful for it, and I'm proud of her. My father as well. You know, I didn't have the best relationship with my father. When he left the house when I was 11, he left us with no car. I didn't speak to him for 3 years, and that was probably the toughest time of my life. But we gained that relationship back. My father's been clean for 3 years. His health is doing better. He's trying to be a better grandfather, trying to be a better father. And, you know, I forgive him. And our relationship is, you know, we're back communicating, and I love it, you know. I tell him I'm proud of him as well, because it's a tough circumstance. You know, it's easy to look at someone who's in addiction and blame them, and blame them for the choices they make. But it's the drugs, it's the alcohol that have a hold of them. And it's not, they don't want to be in that position. You have to understand that. They don't want to be making these decisions. They don't want to put these people in jeopardy. They want to get help. But once they decide to get help and to do something about it, there's great things that can happen at the end. Yeah, recovery is possible, and it happens to a lot of people. You know, you'd be surprised at how many people are in recovery right now that went out and got help. People out there that want to help you if you're in recovery. You know, there are people all over who you have no idea went through, they've been affected by it. You know, whether it's a family member, a friend, themselves personally, if they went through addiction. There are a lot of people that are going through issues that you've been through. So don't be afraid to ask for help. There are a lot of resources out there that can help you and get you the right treatment and to get you back on the road to recovery.
Welcome back to Resolutions for Recovery. And for anyone that's struggling getting placement for their loved ones in treatment, please reach out on Facebook, reach out to Outreach, reach out to New York State, Office of Alcoholism and Substance Abuse, OASIS. 888-614-5400 is the number that you can call. There is treatment available for everyone. No one can say no to that. So please just connect. I'll make it happen, I know that. Off camera, that's what we were just speaking about, though. All of these things that we continue to build are for probably people that are struggling for a long time. We still need to talk about, where does it begin? Where does it begin? Life is not easy in 2019. The world is a crazy place to live in. Really, none of us know the reality of the truth of the state of the world. But I think everyone needs to remember that if you wake up and you have a roof over you, in your life, look at the blessings and the gratitude that you should have. And I love what you're doing every day with your posts looking,
the gratitude.
Life is good for most people. Don't think, big and bring it to you here. Be the ripple in the lake. Be the rock that gets thrown in, have it go out. In our communities, we really can connect and we can really create the life that you want to live. Start there and then change comes. Right? When we all band together. Always community and then out.
Yeah, I in the mornings, I recently, as you know, I bought a house in this beautiful part of the world, and I have a vista that I look out every morning, and it's such a metaphor for my recovery, right? Because, I went from being, as you know my story. I went from being a homeless street kid to, being the person that I am today, and so to be able to have the wherewithal to have a house that is in my name, and to have this beautiful view, and to have these two beautiful daughters, and a job that I love showing up to, and people in my life, and who I'm connected to. It's extraordinary. But the gratitude piece, there's now science, and we've been saying in the recovery community for years, write a gratitude list, and you kind of roll your eyes back. I remember the first time someone said that to me, and I was like, seriously? But there's science behind that. It changes, when I start my day off like that, it
changes how you look at the rest of the day. No one can give you a good day or a bad day.
That's right.
Only yourself.
That's right.
But even after my son died, you can stay in the place of everything that went seemingly wrong. But there was Thomas, who I miss, and I say this all the time, every second of every day. And Thomas on substances, and I don't miss him any second of any day. Two complete individuals. So when I speak with parents, always put a little pad next to you, because now I had never read anything, I didn't do anything, I just, I'm very spiritual, and I think God gave me things to empower myself, just to sit and write 3 things, or 1 thing, or whatever it is that you were grateful for. Big brown eyes, a contagious laugh, or sarcastic humor. I made a list every day of 3 things that I was grateful for my son. And at the end of the month, to read back through this, it changed the way myself remembered my son. So I can be. There is always profound grief for not having him here and not creating new memories. That goes without saying for anyone. But I also had 21 years of incredible memories. Some good, some bad, some whatever, right? But that's what made us us. And I have to acknowledge them. So when you change the way you look at things, the way you look at things change. So you have to create your own world in which to live. And when you wake up with gratitude on your heart, or what can I do to make someone else smile today, the way you conduct yourself will profoundly change, always. Not sometimes, always.
Amen.
Right? So I think, when we talk about helping people, and I don't care what disease you're stricken with,
Yeah. Yeah.
compassion, kindness, empathy.
Well, we're all recovering from something.
Absolutely.
Even if it's not a substance use or mental health, issue. We all have been through. We all have our story.
We all have scars.
That's right. That's right.
And some of them are big battle scars.
That's right.
And some of them, you only got hit with a little shrapnel.
But whatever that shrapnel is, it's your shrapnel.
Correct.
And so how can we, as a community, help support you in your journey to health and wellness? And I love the SAMHSA's, definition of recovery, because we used to say that recovery meant that you didn't use alcohol or drugs anymore, you were abstinent. And, we're really now changing our perception of that, because again, if we look at other chronic illnesses, we would never say, well, you're not in recovery from your diabetes if you had a cookie yesterday.
Right.
That nixes everything out.
Now you're going back to day one,
Right.
and you're a failure.
Right.
It doesn't happen, right?
No, we support that person in their journey to health and wellness. And I think, given what you just said in terms of of what we've just been talking about in terms of we're all recovering from something, how do we as a, help heal our communities, and I think a big piece of that, is getting out of self and being of service.
Yes.
How can I be of help? Not what do you got, right?
Not what do you got for me?
Right. That's right.
What can I get from you?
Right. How can I help?
How can I help you?
Right. And we know now, it actually, that
All
feeling.
of these change.
Right. It changes our internal makeup. We've been saying that in the recovery community. Get out of self, be of service. Like, that's part of the recovery process.
Yes, it is.
Get out of that narcissistic thinking and that self-centeredness, and, be able to, make coffee or, do something for someone else. Take them, shopping if they need to, or, and
Something as simple like, where you are, and I know that you've had some snow up there, but even when I had a young family and we had some snowstorms, and the other young moms on my block, we used to, especially one, we'd walk through in any kind of weather, because we both had 3 young kids under the age of 5, and at night, it didn't matter what time we went walking, we were going walking, because you blew off everything. It just made you feel so much better. But to go to all my neighbors that I knew couldn't get out, we'll make our walk to the store today, and we'll bring home milk, we'll bring home whatever it is that you need, because that made me feel better.
Yeah, we often say, I get much more out of helping you than you probably get out of my helping you. And it's true. There's evidence behind that, that points to that. And it's a mood changer.
It is a mood changer. Like I said, you can't wake up on the wrong side of the bed, because you're the one that put yourself there. So rewind that story. Change something. That doesn't mean you have to be happy every single day. So there's that illusion, right, in the world that, life sucks because I'm not happy today. No one said you were going to be happy every single day.
Really?
Did anybody ever tell you that life isn't fair?
Well, that's part of the,
and that's the truth, right?
That's part of the addictive mentality. Is I want to, I want to feel this way all the time, or,
right.
And not even just the addictive mentality, but we live in a society that thinks that we
I don't want to feel,
right,
or I'm supposed to live this magical life that I'm supposed to feel happy, and stuff's going to make me. No, it's not going to make you happy.
Life happens.
Life
so how
happens.
do we deal with it?
Find your quiet peace.
Yeah.
And it's okay. I'm usually always happy, and when I am not, people go, "Oh, what's that?" I go, "Nothing's the matter. I just don't feel like talking." That doesn't make anything the matter. It just makes me quiet for this moment. So don't beat me up for not being bubbly.
Putting on the show.
Yeah, and it's not a show for me.
That's right.
So it's just who I am. But but I also am quiet.
Yeah.
I also, believe it or not, do a little thinking and a little praying and a little, where I need to be.
Yeah.
Because in my life, when that doesn't happen, then I end up getting slowed down by a lot of different reasons.
It's your higher power's way of saying, slow down.
Be
If you're not
still
going to listen to me.
and know that I am God. And he lets me know, and however he has to let me know. And then I succumb.
Well, no more broken.
No more broken
bones.
things. No more, But it's when you listen to those little voices, they have a profound effect on your life. It's not anything that's pretend that's going on. There is an innate sense in every single one of us.
Well, it's knowing who we are. I have an object that I carry around with me, and the message on the object says, "To thine own self be true." And part of what I've had to learn in recovery is to know myself.
Yeah.
And that's nothing new. I mean, the sages have been telling us this for millennium, right? We have to know who we are, and we have to. And part of health and wellness is being able to know where the limitations are. And what are the boundaries, that I need to create around my work life so that I don't, 24/7. And I tend to work 24/7, but
so do I. But I'm learning. Yeah.
But we have to find that balance, and similarly, in terms of, love, and in terms of family, and in terms of spiritual practice, where is that, and I'm not necessarily a religious person, but I'm a spiritual person.
I'm a spiritual person too. That's all I am. At the end of your life, you're never going to say, "I wish I had worked more."
That's right.
That won't be the statement that anyone. So create that world for yourself. And how do you mitigate around that? Because a lot of all these pressures that we put on ourselves lead us to coming home and saying, "I need to have a glass of wine, I need to have a drink because it's just too much for me to handle." But when we show up and say, "I need to meditate for 15 minutes before I go into my next meeting," right? We need to find other alternatives. And so we'll get back to what we're really, we always...
We've discussed
We have,
philosophy.
But it's so important when we're talking about accessing
care
for addiction and mental health, right?
Yeah.
Because we have to slow ourselves down. This is not something, this unfortunately is not a disease that is going to be solved in a 10-day course of antibiotics. It is not going to be solved like that. This is, you can look at it as, oh my God, this is a lifelong struggle, or, okay, I have to pay attention to myself for the rest of my life. That's how I would choose to look at it.
Well, if we get people the treatment that they need when they need it, and the other piece too is knowing that there's incredibly effective treatment here in New York State. I know that, and particularly down here, you and I have worked on this issue in the past in terms of folks that are being sent out of state to other programs, in the hopes that, they'll get well. And that may be effective, but, that there is really good, effective treatment available, here in New York State. And if we can get folks that treatment.
The piece that, when we opt to send, and there are some very good facilities that are outside of the state. Not all. That's a whole nother show. But the point that we miss when we send our loved ones out of state is that addiction, substance use, mental health, they are all family diseases. And everyone gets to ride that roller coaster.
Yeah.
And when we can't do the parallel, walks of treatment
And recovery,
because at some point you're going to come to the, you're both going to come to the
Well, you were telling me a story about your, the person that you were working with, that that folks had made plans without involving the family, so that when the person got out of treatment, There was no.
There's a disconnect.
There was no interface that had happened, so that person couldn't be reintegrated into their family and community because the family had not been consulted. And I think,
and families need to be consulted, because here's the thing: a lot of times, the home may not be the best place for that person to come home to, and the rest of the family has been beat up, and or we have grown-ups well into their 30s and 40s that should not be living at home. You know, that mom and dad really do need that respite now. But if we don't all talk about it, you know, it may be you can't come home yet. Or this is not a good place for you. We want to sell the house. We want to travel. We can't. We don't feel like we can do that. There just needs to be that conversations, right? Always that conversations.
Right.
You know, and I think so often family is left out. You know, and I will speak for myself. Certainly, you know, with Thomas, oh, just go home. He's going to be fine. You just go home and take, you know, I never understood. Okay, well, he's going to come home. Oh, that'll be great. He'll be well when he gets home. No, but no one took the time to tell me that.
Well, I think too that people didn't. There was such a disconnect between, you know, we're so individualized in this culture. You know, we've sort of disconnected as a family unit. So there wasn't that. You know, how do we work together, you know, to integrate, you know, the family into this conversation. And I think that's really changing because of the advocacy work that the family groups, you know,
we have to do that, but to have the wherefore to have the treatment, and there needs to be a different.
People don't know that family members can get treated as well.
Absolutely.
Through treatment centers, and that insurance can cover that.
Absolutely.
It's really important for folks to
But, you know, because when families are dealing with high blood pressure, stress-related illnesses, you know, all of those things, it's due to the stress that's in your household. It doesn't, you know.
Well, in the past, it's the family has been the insurance card and the transportation system, and that's how they've been viewed as. And there's not this recognition that, you know, the illness has impacted, you know, not just the person with the substance use or mental health issue, but that the stress that the family has gone through. You know, it's very hard as a mother to show up for work, you know, a 40-hour plus work week when you have a child at home who's sick, and you're trying to get that child, you know, the care that child needs, and how do I navigate through the system, and how do I do this, and how do I do that?
And
while at
where
the same time,
is my child right now? Are they stealing something? Are they doing something? Are they in an alleyway? You know, not knowing all of that. It's just, you know, and showing up for other children in the family, and that, you know, you put everything in compartments in your brain because you have to.
Right.
It's survival then at that point. But all of these things put together, you know we have good treatment. You can't be, no one can say no to you for your treatment. You can get help. You have a voice that needs to be listened to. And if you know that you have a voice, but if you have laryngitis at the moment, there are a lot of other people that will speak up for you.
Well, I think getting involved in, you know, in community-based organizations that are advocating for, you know, these issues is so critical. I read a book, American Fix by Ryan Hampton, and he talks about what happened for him when he came out of, you know, the shadows of, you know, shame around his addiction, and he got involved, you know, in the recovery movement, and the empowerment that happened for him, and the engagement that happened for him in his own recovery in doing that. I think families are experiencing that too. I've been to so many funerals, unfortunately, over the past, you know, number of years, and it's so sad to see family members still so. Not only do they have the loss that they've experienced of their loved one who's passed away, but it's the loss of the connection with the community. if their loved one had cancer and passed away from that, the community would come around and have casserole dishes. I know that, that Gary from Shatterproof talks about that if his son had had, cancer.
I say the same thing, and I've said it to my little community.
Yeah, yeah.
I was your Girl Scout and Boy Scout leader. I coached girls lacrosse. I taught religion for many years. I was all of these PTA, and I worked, but I was all of these things in the community. And then all of a sudden, my All-American boy was, don't talk to that Ventura family anymore. You turned your back on me. What made me bad? Nothing made me bad. It made me have a crisis in my family. And if it had been anything else, you would have been driving my other kids. You would have been helping me. You would have been supporting me.
You would have tied ribbons around my trees. Had fundraisers for me.
Exactly.
Yeah.
But because it was substance use, we were bad people all of a sudden. Don't go over there. You might catch that.
But that's changing. And it's changing because people like you have stood up and spoken out and are advocating and creating these community-based organizations which serve as a place for other people to come and get connected to, right? So that they're not alone. It's that feeling of aloneness and that shame of, it's not that I did something wrong, it's that I am something wrong. That's addiction, right?
Yes.
And it doesn't just affect the person with the illness, right? Same thing with mental illness, mental health issues.
What did I do wrong?
What did I do wrong that my child has depression or anxiety or is bipolar?
Nothing.
Like, if only I would have done this, or if I didn't work so hard, or maybe if I
maybe if I didn't give them peanut butter and
baked
jelly
more
every
cookies.
day. Exactly. Whatever the stupidest of thoughts come through your mind.
So that's the healing that I think that we have to do as a community. And it's, again, it's the people who are stepping out and speaking out. In the LGBTQ community that I've been involved with, it's not until the family members linked up and stood up and said, my child's gay. And I love my kid, and I want my kid to be able to marry and to be able to, bring their loved one, I want to be able to walk my child down the aisle. I want to have grandbabies, right?
Right.
So when the family stepped up and joined, the members of the LGBTQ community, not being ashamed of their child, but being proud of who their child is. We're seeing this happen, I think, in our world now, where family members are linking up with us, and they're saying, we stand beside you, we love you, we were impacted by this illness with you, and we want to heal with you.
Yeah, absolutely.
And that's the hope, and that's the power and the promise that recovery.
Why does judgment doesn't belong anywhere. Judgment and criticism doesn't belong anywhere, right? Because I still always love, the more you point at someone else, 3 fingers are still pointing back at you. So why do I need to look at what you're doing? I don't. Never.
Well, I like what you're doing.
But, we're so critical of everyone else that we just need to collaborate. And I would love to see, down here we do have many different treatment modalities. We are never going to be at a loss for each one of those businesses because they are businesses, right? There will never be a lack of patients.
But there's multiple pathways to recovery. Multiple ways of getting,
so why,
like any other illness.
Why struggle to get that adolescent when we have outreach on Long Island that treats the adolescent and their family? Why wouldn't you, we all have to work together. Don't grab everybody. And, I know that CHAMP will probably be very effective with medication-assisted treatment too, because that has to change.
We've been working very hard on getting folks, the medication that they need, because again, like other illnesses, we use medication to treat that illness, and that doesn't mean that you're not in recovery. And unfortunately, even in my own recovery community, there's been stigma around folks that are in recovery that utilize medication to support their recovery, and I've been, very vocal about that.
Because it's a terrible thing to walk into
Oh, it's
a 12-step fellowship. Oh, you're on a Vivitrol shot? Oh, you're not in recovery.
So
you have to leave.
I have to tell you that that's changing, that there are actually 12-step now programs for folks that are on medication to support that. And then even within, the 12-step world, there is an understanding and an appreciation that some folks, and the science shows this, that when you take folks off of medication because they're not really sober or in recovery if they're on that medication, that you're setting them up
for failure.
For failure and for reoccurrence of their illness. We would never do that with any other illness. Why?
No, we would not. You wouldn't take someone off insulin.
Right.
You wouldn't take someone off.
Similarly, I've been in situations where, folks with depression or anxiety who are on that medication to treat their mental, health issue have been told, well, you're not really in recovery if you're on medication. I mean, that's archaic, very ignorant, thinking. And we're starting to reverse the stigma around that because people are speaking out and we also, the science, behind this is now much more available to people. But in terms of the insurance piece, the insurance companies are now being encouraged to utilize medication and to not deny folks access to the medications, life-saving medications, which will support their recovery.
The best way that we can do medication-assisted treatment is when the physician prescribing works with the treatment to make sure that both pieces, because the psychosocial work has to be done along with that.
And the therapeutic work that
has to be done together. Absolutely. And they both need to be on the same page.
Right, because again, you wouldn't be given another medication and not have the
the
education
wraparound services.
and right, exactly.
Because way too many times, I know still here on Long Island, and this is for the viewing public, if you're being told that it's $600 cash to get your prescription for your life-saving medication, you need to call us because that doctor is not doing the right thing. It should all be
if it's a cash in hand, warning.
Warning.
Similarly, if someone says, oh, I can get you into treatment and it requires a plane ride, not a good idea.
Right, exactly. And you won't, oh no, there won't be any bills at the end of that.
Except you may have to mortgage your home.
Correct.
Yeah.
Thank you, honey.
Oh, thank you so much.
She is the best. Thank you for joining us today. If you have any questions, just please, there's no stupid questions, just the one that's never asked, and it is a matter of life and death. Reach out. We can change your world. Thank you. Have a great week.